Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me.
You've reached the Ascension System Office General Mailbox. After the tone, leave a detailed message and someone will respond to your call. Thank you.
I'm trying to reach CEO Joseph Impicciche, and he can contact me at that number, and I have a message that I would like to give to Ascension. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the x-ray, CT, MRI imagery and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I have compiled over 10 hours of video documentation on what happened to me on my YouTube channel, and the name of the channel is My Medical Nightmare. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, E-M-T-A-L-A. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network, LLC, and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time. And so this phone call, I challenge the misdiagnosis of Ascension St. Vincent's East Hospital, Birmingham, Alabama, and I challenge the policy of this hospital. And Mr. Impicciche, I think you need to look into this, please. Please listen to my message, look into what I'm saying, and you're free to contact me. Thank you.
Golden Parachute deployed Joseph Impicciche, CEO of health provider Ascension, to retire after 2 decades of service to Catholic healthcare. Ascension, one of the nation's leading non-profit Catholic health systems, announced on June 24, 2025, that Chief Executive Officer Joseph Impicciche will retire at the end of the calendar year following more than 20 years of service to Catholic healthcare. He was CEO of this company for 6 years. Ascension's board of directors has appointed President Eduardo Conrado to serve as the organization's new head effective January 1, 26. And the press release reads, "This long-planned transition reflects a clear and strategic path forward for Ascension, grounded in thoughtful succession planning and deep commitment to its mission. Mr. Impicciche will continue as CEO through the end of the year and remain actively engaged during the transition to support continuity and momentum." The new CEO, Eduardo Conrado, has served as president of Ascension since 2023, joining the company in 2018 as executive vice president, chief digital officer, later becoming Chief Strategy and Innovation Officer. This comes following perhaps the most turbulent year in the company's history. In May 2024, Ascension was hit with an epic cyber attack, disrupting and causing chaos in 19 states, 140 hospitals. There have been numerous claims and assertions citing evidence of corruption in Ascension's management. Ascension found its operations under investigation and scrutiny by U.S. Senator Tammy Baldwin of Wisconsin, who raised concerns that the healthcare provider was operating in a fashion similar to a private equity fund, when in fact it enjoys not-for-profit tax status in the United States. Squeezing staff, closing facilities, extracting cash from its member hospitals for dubious management fees to advance its investment activities, putting patients and providers at risk. She pointed out the Ascension CFO Elizabeth Fosage highlighted Ascension's $18 billion of cash and investments at the time. On September 26, 2024, the rating agency Moody's lowered Ascension's outlook from stable to negative, stating the adjustment reflects Ascension's challenges in improving operating cash flow margins to pre-pandemic levels. Late in 2024, a federal lawsuit was unsealed in the state of Indiana accusing Ascension of obtaining millions of dollars in funds by submitting thousands of false claims to Medicaid. The figure cited is somewhere above $10 million. In a surprise move, in August 2024, medical biller R1RCM was announced to be going private in an $8.9 billion deal. Towerbrook Capital Partners and Clayton W. and Rice announced they would acquire the healthcare technology company. Towerbrook and Ascension were the company's largest shareholders. Ascension was R1RCM's number one client. Many accusations which can be read online from current and former employees about how the internal structure and management of that company has disintegrated. In 2024, Ascension was forced to sell off many of its hospitals and medical practices. On July 25th, they announced they were selling 9 hospitals in the state of Illinois. An estimated $450 million deal was closed in November 2024 to sell 5 Birmingham, Alabama area hospitals to UAB, the University of Alabama at Birmingham. These would be the St. Vincent's facilities. Major unresolved issues about Ascension's questionable business practices. Contrary to the Catholic Church's stance on organ harvesting and illegal organ trade, at almost the exact same time, actually before the deal was cleared by the church, UAB was accused of stealing human organs of deceased autopsy subjects, formerly inmates in Alabama prisons. This has moved to trial in Alabama and is currently ongoing as of July 9th. The judge in the case cited that there was more than mere circumstantial evidence of conspiracy in the complaints. There were some reports that if Ascension had failed to secure a buyer for the St. Vincent's outfit, they may have closed and abandoned the 5 hospitals, resulting in 5,000 healthcare working jobs lost. Big questions remain in the UAB deal because they got 5 hospitals and more than 10 additional ambulatory satellite sites for $450 million. However, according to the numbers, just the main hospital in downtown Birmingham made around $500 million each year in annual revenue.